So the GLP-1s have this reducing inflammation effect on the body. It calms down inflammation. It acts as an appetite suppressant in the body, and that's where a lot of people are noticing a lot of this weight loss from. It also has cardiometabolic impacts in addition to reducing inflammatory markers. We're seeing really great improvements in just overall cardiometabolic markers, insulin sensitivity, A1C numbers, all of that, helping people move away from that pre-diabetes stage, closer to health. And then we're also noticing the gut microbiome impacts on this, as well as the brain effects, right? The dopamine pleasure centers and things like that, helping with addiction. That's so many things this is doing outside of weight loss. It's just there's a reason our bodies make it is because it does all these beautiful things, and it's so fantastic to see the scientific community really embracing all of the other areas that this can help it with.
Your health is shaped by more than symptoms. Through real stories and expert insights, we explore how your genetics, environment, and daily choices affect your well being. We uncover root causes and share practical tools to help you find the healing you need. Welcome to the Forum Health Integrative Medicine Podcast.
As I was doing research when GLP-1s first hit the market and we were exploring weight loss and these new peptides for the Forum Health Clinic, I was doing some research side by side with our providers, and I was shocked at what I discovered. It really went from weight loss to whole body healing. And this episode is all about why GLP-1s make sense for chronic disease. When you think about it, it makes perfect sense that GLP-1s go far beyond diabetes or weight loss because their core function, these medications calm inflammation. And inflammation is the spark behind nearly every chronic disease. In our patients, we're seeing firsthand when we start someone on a GLP-1 protocol and we follow up with their lab work, we're often seeing lower CRP, reduced triglycerides, improved A1C, and even better insulin sensitivity. So these aren't just metabolic wins, these are inflammatory wins. And when inflammation comes down, the entire body begins to shift out of that disease acceleration mode. And that's why we're seeing GLP-1s help with conditions that aren't even primarily metabolic, things like PCOS, autoimmune flares, gut dysfunction, and even cognitive decline. If you look at something like the Bredesen protocol for Alzheimer's prevention and reversal, it's built around stabilizing blood sugar, calming inflammation, and optimizing insulin signaling. Those are the exact pathways GLP-1s support. So when researchers first discovered their neuroprotective effects decades ago, it wasn't random. It was rooted in the same principle: reduce inflammation and protect the brain. PCOS is another great example. It's classically considered a hormonal condition, but at the root, there's insulin resistance and chronic inflammation driving that entire picture. Irregular cycles, androgen excess, cystic ovaries. So, if we can use GLP-1s to improve insulin sensitivity and lower inflammatory cytokines, we're not just managing symptoms, we're reversing these underlying drivers. So, when we zoom out, the beauty of GLP-1s is that they fit perfectly into what functional medicine has always taught, that inflammation is the root cause of disease. In our clinics, we're seeing inflammation markers drop, and that's meaningful because when you calm inflammation, you can improve everything from PCOS and insulin resistance to brain fog and even neurodegenerative conditions. It's the same principle behind protocols like Dr. Bredesen's work on Alzheimer's. Fix blood sugar, reduce inflammation, and you can change the trajectory of disease. GLP-1s just happen to be the modern tool that's giving us a biochemical way to do it, which is so cool. So today, we're going to really just focus in on how GLP-1 medications have evolved beyond their use for weight loss and what that means for patients struggling with inflammation, brain fog, and cravings. Today, we have our guest, Erika Shepard, our nurse practitioner, who is a board certified family nurse practitioner with Forum Health, who specializes in integrative approaches to hormonal, metabolic, and mental health. She combines advanced science and compassionate care to help patients overcome fatigue, inflammation, burnout, and brain fog at the root cause, guiding them toward sustainable wellness. Welcome to the Forum Health podcast. We're here to bring you real conversations about functional medicine, science, and healing. All right, let's get started. Hi, Erica. Thank you so much for joining me today.
My pleasure, Amanda. Thank you for having me.
Absolutely. So, today we're diving into one of the most talked about topics, I think, in healthcare right now is
Uh-huh.
GLP-1s. And
Uh-huh.
most people know them as the weight loss medications, the shot that takes your appetite away and you lose weight, right? But there's
Yep.
so much more to that story. And I know that when we were researching if we were going to bring this into our network, if this was something that we were going to offer, when we really looked at like the mechanisms of action and what was really happening in the body, the research in brain inflammation and dementia, it was so empowering. So
Right.
today we're gonna talk more about why we chose GLP-1s as part of our protocols beyond weight loss. All
Yes.
right, so Erica, can you tell us a little bit about how GLP-1s were first discovered and how research evolved from diabetes to brain health?
Yeah, totally. So, GLP-1s, as you know, are being touted in the diabetic world. It's like, okay, you can have the shot once a week. It's to help keep your diabetes at bay. And even in some cases, reversing it and reversing people out of diabetes and prediabetes. But, as the research is real hot right now, the GLP-1s are like the most popular girl at school at the moment. And where this has gone to is that they're finding, in these studies, animal studies and human studies, is that there were so many benefits beyond just, you know, metabolic health and regulating insulin and blood sugar levels. So, with the brain health, they're finding that that the GLP-1s are working as a potent anti-inflammatory, like you said.
Mhm.
And with that, it does go into the blood-brain barrier and provides that neuroprotective effect by reversing oxidative stress
Yeah,
and neuroinflammation. So when it comes to Alzheimer's and neurodegenerative conditions, there could be a great potential for the GLP-1s being protective of those processes going forward, and maybe even finding a way to biohack and help reverse in some cases.
absolutely. And I'm just so when we started looking at this before, one of the things that I thought was just so interesting, just an interesting tidbit is that when GLP-1s, they've been around for decades. We know that.
Right.
But
Right.
when
Ozempic is not like Ozempic is new, but like GLP-1s are not new.
yeah, it's not this isn't new science, and
Right.
I don't know what came first, the chicken or the egg, right? But
Right.
I remember when I was doing my initial research on GLP-1s when they were first coming to market, that they were actually discovered, or at least it's been known for quite some time, that GLP-1s were first used in patients who have cognitive decline and dementia and Alzheimer's, and it really worked for reducing neural inflammation, slowing down the
Yeah.
progress of that disease in patients. And the reason it got kind of switched over to more of the cardiometabolic
Right.
area was because of the side effect of the appetite suppressant. And so it was actually first modeled or looked at for
Right.
dementia, Alzheimer's, neuroprotective inflammatory conditions, but that population of patients were already susceptible to poor
Exactly.
appetite, that the research made a flip, and now we're just circling back to it now decades later. I don't know if we're the whole country is circling back to it. I think that this information and providers like the ones at Forum Health or, who've studied peptides a little bit more extensively have kind of known this for a while, but it's so great
Right.
that this science is now reaching the masses.
100%. I mean, the other name for dementia Alzheimer's is type 3 diabetes.
Yep.
And so, and that gut brain connection and that inflammation, it's connected. And so the fact, yes, bringing up that history point of what it was initially used for, and then finding, okay, well, we're actually going to use this for the diabetes instead. It makes total sense. But going back to its original use,
Yeah.
I think we have a huge opportunity for improvement there. And I have to say, here at Forum Health Denver, I have had a handful of patients who had been on it initially for weight loss come back and they've maintained their weight, but they loved their mental clarity
Yeah.
on it. And they asked to restart on a low dose for the sole purpose of the mental clarity, reducing
Mhm.
brain fog. It's simply for that use and
Yeah.
using it in microdoses to help them attain that.
Yeah. Obviously, patients can come to and go to clinics for the use of this for weight loss, but we've
Right.
actually seen a lot of our providers incorporate microdosing of the semaglutide or tirzepatide into patient protocols for a whole bunch of different things. Like you said, brain fog, clarity. That's been one of the reasons for microdosing. Like just managing low grade inflammation, not
Mhm.
with the purpose of stimulating that appetite suppressant kickback,
Right.
but in addition to that, autoimmune, PCOS, we're seeing those
Yeah.
those get integrated in those protocols now because they have that inflammatory balance. But in addition, the other really cool thing is gut health. We've been seeing people for both the gut brain connection, and we're seeing a lot more research in the science of how the semaglutide or the GLPs are influencing the gut microbiome in a really good way.
Yep.
So we've been seeing it more for gut related issues. And then in the microdosing area, and then also addiction and behavior changes, I think has
Yeah.
been another because you're really affecting too those pleasure centers of the brain.
100%. What's been really cool about being here at the Denver office is that the patients who come here, Colorado, they got it on lockdown. They really do care about our health. And so the patients who typically come here have already done a lot of work on themselves. They
Mhm.
are very knowledgeable and they just want to optimize at this point. And I do a lot, as I said, as you said, a lot of gut health and a lot of mental health and well-being.
Yeah,
And so when patients are like, okay, I'm already eating right, I'm exercising, they're doing all the right things, where can we, optimize? The GLP-1s have actually been utilized a ton here at the clinic for areas other than weight loss
oh
and
yeah.
very effectively so. So but the little explanation about the brain health, just so you all are in the know, when you eat, your gut releases the GLP-1. It's like a messenger that talks to your brain saying, hey, we've got enough nutrients, slow down. So that's why the GLP-1 drugs mimic and amplify that signal of like, you've had enough, right?
Mhm.
There's enough.
'Cause peptides are
So
just
then
already natural things in the body. So when
they're
we
already
are
natural things in the body.
yeah, so peptide, natural, our body already produces it. When we
Yes.
supplement with a shot of the GLP-1, we're giving our bodies more of what it's already producing.
Exactly. What it already produces. So sometimes, just like hormones can be out of balance and our nutrients can be out of balance, our peptides and amino acids can be out of balance, right? So that's
Mhm.
why GLP-1s, again, it's what your body already produces, just like some people are on hormone therapy. Yeah, your body already produces it, but it's not optimal. But the brain connection where acts in the brain's reward centers, like Amanda's saying, it's like the same areas that fire when we see a dessert or alcohol or other rewarding stimuli. So there
Mhm.
is all of a sudden people are recognizing, hey, I'm drinking less. If I have cravings for alcohol, I'm not actually having as many cravings for alcohol. Some people are having less cravings if they have an issue with vaping or drugs, that they're recognizing, hey, that's actually not as strong as it was. It's because the GLP-1 quiets that dopamine response. So temptation, things that have
Mhm.
typically built that dopamine reward aren't as tempting as they used to be. And I'm really excited to, utilize that more with people who are looking to get past cravings beyond appetite.
Absolutely.
Just to see if they can find more balance in their bodies in that way as well.
At Forum Health, we uncover the why behind your symptoms. With advanced lab testing, hormone optimization, and cutting-edge therapies, we help you heal and perform your best. And now, through shopforumhealth.com, you can access physician-grade supplements trusted by our providers, supporting everything from adrenal health to focus and longevity. Learn more at forumhealth.com and explore supplements at shopforumhealth.com.
So the GLP-1s have this reducing inflammation effect on the body. It calms down inflammation. It
Mhm.
acts as an appetite suppressant in the body, and that's where a lot of people are noticing a lot of this weight loss from. It also has cardiometabolic impacts in addition to reducing inflammatory markers. We're seeing really great improvements in just overall cardiometabolic markers,
Mhm.
insulin sensitivity, A1C numbers, all of that, helping people move away from that pre-diabetes stage, closer
Yeah.
to health. And then we're also noticing the gut microbiome impacts on this, as well as the brain the brain effects, right? The dopamine pleasure centers and things like that, helping with addiction. That's so many things
Yeah.
that this is doing outside of weight loss. It's just there's a reason our bodies make it is because
I
it
mean,
does all these beautiful things, and it's so fantastic to see the scientific community really embracing all of the other areas that this can help with. So we're really talking about not really the weight loss side of this, which is a little bit of the higher dosing. Let's talk a little bit about microdosing. What does microdosing mean in this context, and why are some patients seeing benefits with these smaller doses?
yeah, definitely. So, microdosing is that we are giving doses that are below what's FDA recommended for their initial intent. So, we're giving these smaller doses still on a weekly basis
Mhm.
that are to also help stimulate the body's own natural healing responses when given again has GLP-1. And then that way, a lot of these patients are experiencing these other effects of the GLP-1 without so much the appetite suppressing effect because those higher doses do create an appetite suppression. And
Mhm.
so the microdose provides the benefit because a lot of my patients are at normal or goal weight
Mhm.
and they're not looking to lose a bunch of weight,
Yep.
but they are looking for the benefits, for the various benefits. And so that microdosing can help provide those benefits without the appetite suppression
So
so
it's
much.
just
And even so, even at those lower doses, some people are really still feeling somewhat of an appetite
oh, yeah,
suppression.
I think
Yeah,
that a lot of, our providers too, like, we approached and do approach weight loss a little bit differently. Of course, there's the
right.
FDA recommended dosing. We tend to be a little bit more conservative, or at least some providers in our network that will partner with our patients about maybe when we want to start lower and slower because we can always go up the next week. That's the beauty of a once a week injection. If
Right.
dose number 1 isn't like strong enough, then next week we can always go up. But when you get a dose that's a little bit too much for you, like
Hello.
anybody who's had a little bit too much of the sema can I'm sure they can attest, right? You've either got the chews, you got the nausea, you got the headaches, the oofs, the
The
oofs,
oofs.
the oofs. Ah,
100%. And just for the audience, real quick, the oofs, you have because a lot of people don't know this part, so I just want to
yeah.
speak it into existence. Is that when you're starting to go into that appetite suppression, and then you are releasing the
It's a
contents
Hersheimer's
of your fat
reaction.
cells, it
Yeah.
will be a Herxheimer detox
Your
reaction.
and that's the reason when we do a lot of our weight loss, we encourage patients to do a detox to prep the body first, is because
Yes,
if you get
exactly.
when you reduce your appetite, you start limiting how much goes in, right? And so
Yeah.
your body has more capacity to release toxins that are in storage, that are stored in your fat cells, so that you can clear the body. And what happens with that is a Hersheimer's reaction. Your liver is still backed up. And so you
Yep.
get this release of toxins from fat to blood cells, and they travel
Yep.
to the liver, and they're like, oh, I'm in line. I'm just going to dance in the blood for a little bit longer. And you feel like poo because you've got extra toxins raging in your bloodstream. and your
Yep.
liver isn't clearing them effectively enough, and so you
Right.
feel like garbage. So and that's
Exactly.
a big reason people will our providers will recommend binders and things like that
Yes.
for it as well. Typically so we start a little bit lower on our weight loss side, but when we're talking about microdosing, we're probably starting even lower than that, and it's
Exactly.
really just to give the body just that little bit of in
Yeah.
the amount of
A little
peptides,
boost.
a little bit of boost, a little boost, and
Boost.
to get those anti-inflammatory effects, to get that reduction of brain fog. So, when it comes to, like, the brain fog reduction, do you think that's more because of the inflammation being reduced in the body? Is that the primary mechanism why we're seeing, like, the brain fog reduction?
From what I'm understanding from
Yeah,
what research there is out there, yes, it's the neural inflammation, and listen, we live in 2025. No matter how clean you eat, no matter what you're doing, our world's a little dirty, okay,
yeah.
and a little stressful. So both the external stressors and the psychological stressors are going to cause neural inflammation. Like that's just the bottom line. We are more stressed, overworked, and overburdened by toxins than we've ever been in the entire human history.
Yeah.
Okay. And so the increase in mental health that is just exploded. We have more solutions and medications and things than ever, yet our outcomes are worse. Why?
Mhm,
And I truly believe it's because we are not addressing the roots, which are the things that are driving neural inflammation.
mhm.
So, all that to be said is that in addition to the brain fog and the clarity and it feels like people are like losing the cobwebs from just getting some of that neural inflammation down. We're also seeing a decrease on these microdoses of anxiety,
Yeah.
depression, and and
And
that
that's
can the
interesting too,
upgrades.
because I've seen some conflicting info out there, and I have some opinions, but I also haven't dug into the research. So, but I've been seeing some talk out there that the GLP-1s are actually increasing depression. And
Mhm.
and I don't know if I fully agree with that, or I think it's a one-sided view in my opinion. But what do you have you seen that literature out there?
I have, and what I have seen is from the higher doses, and I have theories
Yes.
on why that higher dosing would possibly contribute to that,
Well, I
which
can speak from experience for myself, and again, I'm not in any of these studies or anything like that, but, like,
okay,
when I
let's speak from
I
your experience, girl, it matters.
yeah, I mean, I've struggled with weight gain my entire life. I've have
Mhm.
it pretty much under control these days, thank you, but I went on the GLPs to lose a few, and I found myself more depressed because didn't have the food to distract me. Like, food was something I'm still always actively
Yep,
working on a relationship with, and when you go on a GLP-1 and you're not working alongside somebody to address your relationship with food, that can be a very
yep,
eye-opening and depressing experience because you literally can't reach for your best friend in the cupboard over there, like, that cookie is
right?
wanting you, but you don't want it, and now you're left what do I want? And there's this absence in the mind because you took something away without the support to figure out what we need to replace that.
That is such an important point because it can turn, like you said, it's almost like a forced sobriety from
Yeah.
something that has been like you said, a crutch in a relationship for a very long time. And that component, that mind body component, is not being addressed
Mhm.
enough. I think that is part of it. The other part is what I think can be the detox response
Oh, yeah.
happen with that.
You're flooding
Yeah,
yourself with so many toxins if you're not addressing the gut while you're doing these protocols.
and
Yeah.
that feels terrible. I know, like right now, I'm going through a mold and SIBO detox. Fun. And
Mhm.
I have been so emotional the
Yeah.
last like month because of and I understand what's happening. It's releasing these toxins. I'm doing things properly, but also it's offloading that and there can be, energetic components, we don't talk
Yeah.
about that enough, to that release of those toxins as well.
Mhm.
And so if you were like, I was on a higher dose of a GLP and I was detoxing, I was so emotional, you are not crazy, you're not alone. And I
The
don't
other thing
think
too is, like, they don't we aren't removing a lot of times the lifestyle and, like, diet and stuff, like, there weren't changes made or There are we guide people on the changes at Forum, but in some of those
Right.
early studies, it's here's a shot. It's gonna do the work for you. And
Correct.
nobody they're still eating out and, like, eating the bad stuff too. So as they're releasing toxins, there's still a larger burden, like, there's still that burden of toxins coming in that
Yeah.
a lot of people hadn't wrangled in yet when I think some of that information was being shared.
1,000%. 1,000%. So, so glad you brought that up because it's so important. And again, what we do know from the studies that have been coming out is that they do have a positive modulation of both the dopamine and serotonin pathways. And I think that's just a little more obvious in the microdosing group.
Microdosing.
It's because again, you're not necessarily dealing with the food component so
And
much
a
and you're
lot
looking
of time
at
you're in our clinics too, we're not seeing that as much because we are supporting the liver, and we're taking
yes.
people through that comprehensive approach of slow first, like,
No.
you don't
Low.
want to have that reaction in the body.
Mm-mm.
It it's traumatic.
I've
It
seen people in the
hurts.
hospital from that
Yeah.
reaction and gastroparesis, and I'm
Oh,
like,
it's
"Whoa,
hard.
well, of course, that's not a pleasant experience. You're not gonna wanna do that again."
Yeah.
No way.
And then also, like, you're prepping your body for post semaglutide or microdosing maintenance, where you can
Yes.
continue to be on this a little bit more long term, but at the micro doses. So you've got your appetite back and you're learning how to live with the appetite again. But then if you're doing all of this, like if you're doing the detox support and stuff like that to have a successful journey, weight loss journey, or a more successful journey, then when you go to titrate off and you go wanna go to that maintenance dose, your liver and your body has biologically, like, is starting to recorrect itself. It's not gonna want that rebound weight because you've been doing stuff to keep stuff moving and get it out of
Exactly. Exactly, moving and grooving, totally.
moving and grooving. I know
Yes.
we started talking more and more about the weight loss side, but I think that tangent was well worth the detour. If we
Yes.
circling back to just more of the microdosing and the inflammation, inflammation is one thing that we say in integrative and functional medicine is it's the root of all chronic disease, right? So realistically, for autoimmune conditions and, some these inflammatory driven diseases, semaglutide or GLP-1s, tirzepatide, all the other ones that are coming out now too. There's so many now. These are all like these all have a place in chronic disease management and reversal of conditions.
Yes, I was just having actually a conversation with a new patient right before coming on here who has been just so sick for so long, pass and gut issues, the whole shebang, and she was even asking, "Well, what about a GLP-1
Mhm.
for helping with this process?" And we need to get her labs back and all that stuff, but I'm like, "Absolutely." Like this in a microdose, your body is so inflamed, it is so hyperreactive.
Yeah.
Her immune system is also tanked. She gets sick with everything anytime the cold, flu, COVID, whatever comes around, that
Mm,
your body needs support to reset. And GLP-1s are proving successful at
yeah.
lowering those immune markers, boosting the anti-inflammatory catecholamine things in the body, and
Yeah,
it's very impressive.
it
So I'm
is.
like, "Yeah, we can definitely take a look at that to add to your care." And the people who have been what's been really interesting is the people who have these conditions that they're like, "Okay, I need to lose, like, 15, 20 pounds," right? Just a little zhuzh.
Just the
And
microdosing can do that with just reducing your inflammation. If you reduce you're
exactly.
holding on to so much weight or, like, just the inflammation
Yes.
can drop that last 5.
That's exactly it. I don't think yet with my patients that I've had to put anybody over 20 units a week because they're getting the results from the inflammation lowering of the
Mhm.
micro thing. But then again, they have these other conditions like autoimmune, etc.
Yeah.
And they are like, "Hey, I'm actually feeling better, brighter, more energy." That's a big one.
Mhm.
I have more energy. Then again, knowing that you
Get
can have a little
more energy.
decrease in energy in that initial like detox, just
Yeah.
back, but also understand if once you get that inflammation down and you're past, some detoxing, that people are bouncing back bigger and brighter with their energy levels than ever.
Yeah. You mentioned something you're waiting for labs to come back. What labs are important for you
Yeah.
when you are prescribing or talking about semaglutide or GLP-1s with patients?
Totally. I just want to make sure their thyroid and hormone levels are coming back okay, because sometimes their root cause is actually you have severe hypothyroid and you didn't know it. And we have to
Mm.
correct that first before,
Yeah.
you gained weight because you have a bad thyroid. So things
Yeah.
like that, like we got to make sure those things are not at play. But then also, I want to make sure they're not hypoglycemic.
Mhm.
And, I've had patients come back with their fasting glucose in the 50s. And I'm just like, okay, time out. We may need to to just check out
Yep.
what's causing that and work on your health from another perspective. I don't want to risk tanking you into further
Yep.
hypoglycemia,
Absolutely.
things like that.
That's
Yeah.
good. Love that. So, Forum Health, we kind of take a different approach
Yeah.
than conventional GLP
Right.
use, which today is weight loss and type 2
Yeah.
diabetes, right? So,
Right.
we I would I am putting out in the universe that there is so many more applications to this. It's not just weight loss, it's
Hmm.
cardiometabolic, it's for the biohackers out there, and
Yep.
it's also for the chronic disease. I mean, it
Yeah.
really hits the spectrum.
Right.
And so we use different at Forum. We do have your traditional use in the weight loss, but we
Right.
also approach with microdosing for all of those different patient types just to
Right.
I mean, I think the biggest thing is get that inflammation down, but there's so many more benefits as well.
100%. And the big studies right now that have been mostly done on people with type 2 diabetes and
Mhm.
obesity are definitely the cardio metabolic protection, the kidney protection,
Mm. Yeah.
improving of kidney, non-alcoholic fatty liver has been shown to
Mm.
reverse with of GLP-1s, which is big. And then again, the Alzheimer's, and then the obstructive sleep apnea, actually, the
Fertility
inflammation,
now too.
infertility, and the
Fertility
PCOS.
is another I
Yep.
mean it's just when you can lower inflammation, what can't you do? What can't we do?
Can't we do? It's all possible. And
Yeah.
like you said early on, Amanda, this is already naturally occurring in the body. I have a lot of theories as to why we are lower
Mm,
on GLP-1 production in our body. And
me
I think it's a
too.
sick cycle of like, you know, we are more inflamed, therefore our body's producing less of it. But then it's the thing that also helps
Yep.
reduce the inflammation. So it's,
But
I think,
also,
just
what do we need in our diets in order for our body to produce and deliver is fiber, which we don't get enough fiber in our diets anymore, and we've been chronically absent of that. So, how has that affected the overall production and levels in our bodies? I think that that plays a role into it. The different types of fiber makes a difference in order for your body to
yep.
produce it. I mean, that's a whole
Yeah,
nother topic.
that's a whole nother
We'll
topic for a whole
we'll
nother
save that
podcast.
for another day. Yeah.
Yes, but
Oh.
you are absolutely right. There are ways to help our naturally occurring
Yes.
GLP-1. And
Yep.
that's for another podcast. I think that'd be a good podcast, to
It
be
will be a
honest.
good part. Yeah, we'll do it.
Yes, yes. But it's so true. But what we do know is that getting those levels back to optimal, lowering that inflammation, because everything's connected in the body, that's why it's showing such promising effects in all of these areas of chronic disease, which of course in functional medicine we see as all rooted down to inflammation. So
Absolutely.
it's not like a miracle drug, but it makes sense.
Yeah, it does. It
The
does make
math.
the math is mathing.
The math
So,
is mathing.
GLPs are more than weight loss medications. They're tools for healing inflammation, balancing metabolism, restoring brain and body function, and even addressing chronic inflammatory diseases. When combined with
100%.
functional medicine, lifestyle, and nutrition, they can help people not only lose weight, but truly feel well again. Erica, thank you so much for sharing your insight and experience with us today. It's incredible to see how GLP-1s are helping patients far beyond weight loss, from reducing inflammation to improving brain health and energy. If you'd like to learn more about GLP-1 therapy or find a Forum Health provider near you, you can visit forumhealth.com. And as always, thank you for listening to the Forum Health Integrative Medicine podcast, where we talk the science stories and the healing from the inside out. Don't forget to like, follow, and share.
Thank you for joining us on the Forum Health Integrative Medicine podcast. Each episode, we help you understand your health from every angle and inspire your lifelong wellness journey. Follow the show, share it with someone who needs hope, leave a review, and take the next step toward feeling your best at forumhealth.com.